Dear student, today we are going to discuss the general urine examination, in which we are focusing on the physical and chemical examination of urine. So, a general examination of urine, which is also called routine examination of urine, are abbreviated as urine RE, is usually done as a part of the physical examination during pre-operative testing and upon hospital admission. It is used for the diagnosis of infection of the kidney and urinary tract, and also in the diagnosis of diseases unrelated to the urinary system. The general urine examination includes physical examination, which is microscopic examination, chemical examination, microscopic examination, culture and sensitivity, and cytopathology examination. The 4 and 5 are often done, but the main are the physical examination, chemical examination, and microscopic examination. These three parts are usually done in the routine examination. Now we are going to discuss some of the terms, which is anuria, means the absence or production of urine which is less than 50 ml per day. Oliguria is the decreased production of urine, i.e. when there is the production of urine less than 400 ml per day, or we can say 400 ml, less than 400 ml per 24 hour. Polyuria is increased production of urine which is greater than 2.5 liter per day. Gross hematuria is the presence of blood in the urine which can be visualized by the patient or someone through naked eye. Microscopic hematuria, when blood is present in the urine but can only be determined under the microscope or in the lab, we can say it is a microscopic hematuria. Proteinuria is the presence of blood in urine when there is greater amount when there is protein which is greater than 150 milligram protein, 150 milligram protein per 24 hour of the urine, or we can say per day. So we can say it is a proteinuria. Pyuria is the presence of RBC in the urine. Dysuria, pain or discomfort with urination. Frequency: need to urinate more frequently than usual, or need to urinate, or no need to urinate frequently. We can say that when a person goes to the toilet and urinate frequently, we say that the frequency of the urination has increased, or sometimes the frequency of urination decreases. Now in physical and chemical examination, we will see the appearance, color, odor, specific gravity, pH, leukocyte, esterase, nitrate, protein, glucose, ketones, urobilinogen, and bilirubin. The first five, which are appearance, color, odor, specific gravity, pH, these are included in the physical examination of urine, while the leukocyte, esterase, nitrate, protein, glucose, ketone, urobilinogen, and bilirubin are included in the chemical examination of urine. Appearance refer to the clarity of the fluid. Deviation from the normal appearance of the urine may indicate the presence of infection or hematuria. Color corresponds to the specific gravity of the urine. There are many factors which can affect the color of the urine, including food, drugs, and various conditions. You can see in the upper part of the picture in which the color determination of the urine is described. You can see that light yellow, yellow amber, these three are the color which are considered as normal color of the urine, but red, brown, and other colors of the urine are deviation from the normal color, and it indicates some pathological conditions, or we can say indicate that the person has eaten some type of colored food, or is using some type of drugs. Then now in the second part of the lower part of the picture, you can see the appearance, we can say the description of appearance. Now in the first a tube behind which is a paper, and you can see that there is a word there. You can see the words behind, which are written behind the test tube and through the urine. So this urine is clear. In the second picture, you can see a blurred words behind the which are written on the paper behind the urine test tube. So you can say that it is slightly cloudy. In the third part, you can see that you cannot differentiate the words which are written, which is written, so it is cloudy. And the fourth one, which is turbid, you can see nothing behind it. So in this way you can describe the appearance or the description of appearance. Now another property, which is the odor. The normal odor of the urine is aromatic. It is due to its acidic content. Various conditions such as medication and food may cause changes in the odor of the urine. Specific gravity is the measure of the concentration of the urine compared to the concentration of water, which is 1.000 gram per cubic centimeter. The higher the specific gravity, the more concentrated the urine is. Specific gravity. This test value is indication of the kidney ability to concentrate and excrete urine. The specific gravity is normally lower in elderly due to decreased ability to concentrate urine. Well, there is a condition known as specific gravity, in which the specific gravity remains at 1.010 without variation from specimen to specimen. This is usually indicative of the severe renal damage. The normal range of the specific gravity is from 1.005 to 1.030, but usually from 0.1015 to 1.025 is considered as normal range of specific gravity. Now this table indicates the different orders of the urine which are associated with different conditions. The fruity smell, which is associated with diabetes type 1, which is type 1 diabetes mellitus, or fishy smell is related to the urinary tract infection. Ammonia like smell or odor is usually due to UTI, which is caused by Pseudomonas or Proteus. The burnt sugar odor is associated with maple syrup urine disease, and musty odor is associated with food like garlic and asparagus. Normal value of specific gravity is 1.010, but you can say that the normal range from 1.010 to 1.025 is considered as normal range. Increase in specific gravity is due to dehydration, diarrhea, excessive sweating, and vomiting. Decrease in urine specific gravity is due to excessive fluid intake, polynephritis, and nephritis. pH is also a character which is considered as a physical character. So pH provides us information regarding the acid-base status of the patient. Urine is considered alkaline when the pH is greater than 7.0 and is formed in such a condition as urinary tract infection. When the urine pH is less than 7.0 are acidic in nature. The cause may be such problem as diarrhea or starvation. There is an inverse relationship between the pH of the urine and the ketone level in the urine. Leukocyte esterase. Now let's come to the chemical examination, or we can say the chemical characters or properties. Leukocyte esterase is an enzyme which is released from the white blood cell when bacteria are present in the urine. The testing the urine for leukocyte esterase is considered as a screening test for the presence of white blood cells in the urine. A positive reaction warrants further investigation to determine whether a urinary tract infection truly exists. Leukocyte esterase test has found to be very sensitive, meaning that false negative findings are extremely rare. Thus, a negative test finding requires no further evaluation unless the patient demonstrates signs and symptoms of urinary tract. Any positive finding with this test should be verified by urine culture. Normally, leukocyte esterase is not present in the urine, i.e., it is negative. Nitrate, or we can see nitrate. Nitrate is normally found in the urine, derived from dietary metabolites. When gram-negative bacteria are present in the urine, nitrate is converted into nitrite. The presence of nitrite in the urine, then it is an indication that bacteria are also present. This test is used in the conjunction with the dipstick test for the leukocyte esterase to screen for the presence of bacteria during a routine analysis. During a routine urine analysis, it is important to note that the presence of some type of bacteria do not lead to the positive nitrite. This negative nitrite does not rule out the presence of urinary tract infection, especially if the patient is symptomatic. The conversion of nitrite to nitrite by the bacteria requires the microorganism to be in contact with the nitrite for some time. The test is best conducted on the first urine specimen of the morning. Any positive finding with this test should be verified by urine culture. Normal nitrite result is negative, i.e. normally nitrite is not present in the urine. Now let's move toward the protein in the individual with normal renal function. There is no protein in the urine. This is due to the glomerular filtrate membrane of the kidney being impervious to the large protein molecules. In the case of renal dysfunction as in the glomerulonephritis, the membrane is damaged, allowing the protein to pass through and be excreted in the urine. Thus, this test is one way to assess the patients for renal disease. It should be noted that, however, that a small percentage of population may have what is known as orthostatic or postural proteinuria, which is a benign condition. However, if random urine samples are consistently positive for urine, it is suggested that further testing, including the collection of 24-hour urine sample, be conducted. Normal protein result are normally there is no protein in the urine, and so you can say that the normal protein result is negative. Glucose. As a part of the routine urine analysis, the urine is screened for the presence of glucose. The screening is typically accomplished through the use of the reagent strip is dipped into the urine sample. The chemical reaction occur which result in color changes which correspond to the level of glucose in the urine. Normally, there should be no glucose present in the urine, although occasionally a trace amount will occur during pregnancy. Should glucose be found in the urine? Usually, if there is glucose in the urine, usually when serum glucose is greater than 180 mg per deciliter, a condition known as glycosuria diabetes mellitus is suspected. However, further testing must be done to positively diagnose the condition. Ketone bodies. As fatty acids are metabolized, 3 ketone bodies are formed and the latter excreted in the urine: acetoacetic acid, acetone, and beta hydroxybutyric acid. Thus, testing for the presence of the ketone in the urine, ketonuria, is assistive in the diagnosis of diabetes mellitus, as well as evaluating conditions associated with the ketoacidosis states such as starvation. Normal ketone results are negative, means that normally there is no ketone body in the urine. Urobilinogen. Bilirubin, which is one of the components of the bile, is formed in the liver, spleen, and bone marrow. It is also formed as a result of hemoglobin breakdown. One type of bilirubin, known as conjugated bilirubin or direct bilirubin, is changed into urobilinogen by intestinal bacteria in the duodenum. The majority of urobilinogen is excreted in the stool. The liver reprocesses the remaining urobilinogen into bile. A very small amount is excreted in the urine. An increase in the urobilinogen is indicative of hepatic dysfunction or hemolytic process. Urobilinogen levels are typically highest during the early to mid-afternoon. Thus should dipstick testing for urobilinogen be positive. The collection of 2-hour urine would be most appropriate between 1 and 3 p.m. Normal urobilinogen in urine is negative or 0.1 to 1 unit per dl. Bilirubin. There are three types of bilirubin: total bilirubin, direct bilirubin, and indirect bilirubin. Direct bilirubin is also called conjugated bilirubin, and indirect bilirubin is also called unconjugated bilirubin. Normally, direct or conjugated bilirubin is excreted by the gastrointestinal tract with only minimal amount entering the bloodstream. Direct bilirubin is water soluble and is the only type of bilirubin able to cross the glomerular filter. Although it is the only type of bilirubin which could be found in the urine, it is usually not detectable in the urine since it is converted to urobilinogen in the intestine. However, should jaundice occur due to obstruction or liver disease, the direct bilirubin is unable to reach the GI gastrointestinal tract. It instead enters the bloodstream where it is eventually filtered out by kidney and excreted in the urine. Thus, an increased level of the direct bilirubin in the urine is indicative of some type of hepatic or post or obstructive problem. Normal bilirubin in urine is negative or somewhat equal to or less than 0.2 milligram per deciliter. Now, this is all about the physical and chemical examination of urine, but you should know the use of urine strips which are used for such chemical examination. So use a fresh, well mixed, uncentrifuged urine. Hold the reagent strip by opposite end from the test areas and dip the stick into the specimen so that all the test areas are immersed in the specimen. Remove the stick immediately. Prolonged immersion in the sample may wash out the test reagents. Hold strip in a horizontal position and run the edge of the strip against the rim of the urine container or touch the long edge of the strip to absorbent toweling to remove excess urine. Do not bloat the strip. Maintain the strip in a horizontal position to prevent mixing of the reagent chemicals. If you are using a dipstick reader, place the strip immediately onto the tray of the reader. Replace the cap on the container to prevent deterioration of the remaining strips. If you are reading the test manually, proceed with these instructions. Observe the reagent pad at the specified time period. Color changes that occur after the stated maximum read time are not valid. Hold the strip close to the chart and compare the color to read the result. A good light source facilitates accurate reading. Thank you for watching. Thank you.